Good morning, friends. Deliberate about the neck swelling. Now, neck is supposed to be the most complex organ of the body, maybe after the brain, and almost about 85 type of swellings can arise in the neck. We have been always dividing the neck into the anterior and the posterior triangle, but one should not forget a good part is there in the posterior part of the nape of the neck. And we say there's the anterior triangle and the posterior triangle, but we forget about the structures which are below the sternocleidomastoid. And I think all the structures which are below the sternocleidomastoid should be included into the anterior triangle. Look at the complex anatomy which is there. There are so many blood vessels, nerves, lymph nodes, many hollow organs, cylindrical tubes. So there are so many structures which are there. So this is one of the most complex anatomy which can be there in that of the neck. Almost about 200 to 800 lymph nodes are there in the neck, apart from the salivary glands, the trachea, the larynx, the pharynx, and the esophagus. Certain glands like the thyroid, parathyroid, and the thymus. Various potential spaces which are there, apart from the basic things, the skin, fat, and the fascia, muscles, nerves, vessels, and the bones. Now, if you look at the neck swelling, you can divide it into according to the various types of the presentations. Like as per location, you can say about the anterior triangle or the posterior triangle, the nape of the neck. As per etiology, congenital, traumatic, inflammatory, neoplastic, or miscellaneous variety. As per the duration, there is a rule of 7 which is there, that if swelling is there for 7 days, it is inflammatory, 7 months it is neoplastic, and 7 years it is a congenital swelling. Then as per the tissue of the origin, as per the age of the patient, and as per the number of the swellings, more the number of the swellings are there, it's more likely to the lymph nodes. So neck masses can be inflammatory, congenital, traumatic, or neoplastic, or miscellaneous variety. And in the inflammatory variety, there are various infections which can be situated in the deep neck, like the Ludwig angina, the peritonsil abscess, parapharyngeal, and the retropharyngeal abscess. And then there can be the traumatic neck masses like a sternocleidomastoid. At the time of the delivery, there is injury to the sternocleidomastoid, or sometimes after the trauma, there can the pseudoaneurysm of the vessels may be there, and after the surgery, there may be neuroma formation, which can present as a neck swelling. So the common neck masses, basically like the neoplastic, various type of the neoplasm may be there arising from the various structures, or congenital, the development variety like the thyroglossus cyst, dermoids, etc., and the inflammatory, the lymphadenopathy of the various origins, the tuberculosis, sialadenitis, etc., are the various common neck masses. So in the midline, starting from the floor of the mouth, there can be lymph nodes, the dermoid, Ludwig angina may be there, thyroglossus cyst, aberrant hyoid bone, and then the thyroid may be there, the isthmus may be there, and then there are swellings which are there in the suprasternal space of bones like lipoma, or a dermoid, a gamma, a thymus may be there, or sometimes there can be aneurysm from the innominate or the subclavian or even the aorta may be there, presenting in the suprasternal space of burn, and a cold abscess may be there. And the lateral swellings, depending upon that what is the situation, there can be various types of lateral swellings, like swelling in the submandibular triangle, there can be lymph nodes, salivary glands, the ranula, Ludwig angina, dermoids, and the tumor of the mandible. And in the carotid triangle is the bronchocyst, the lymph node, and the carotid body tumor, the thyroid, lymph, laryngocele may be there. And in the posterior triangle, you can divide into the solid swellings or the cystic swelling or the pulsatile swelling. And depending upon that, and the solid swelling, the most common is the metastasis in the lymph nodes, but there can be others like the lymphoma, the lipoma, the cervical rib, or the Pancoast tumor, or cystic swelling may be there. And then the swelling in the nape of the neck, like there can be diffuse lipoma, carbuncle maybe in the diabetic patients, skin infection, various lymph nodes, the occipital group of the lymph nodes may be there, and congenitally there can be encephalocele may be there, or so depending upon the probability of the neck masses, if it's a child is there, then it's can be inflammatory or a congenital variety. In the young adults, again, it can be inflammatory in the congenital variety, but in the older patients, it's much more likely to the neoplastic swelling. So in all cases of the thyroids of the neck swellings, you have to carry out the quadruple assessment, which includes the clinical history and the examination, the imaging, the pathology, and the endoscopy. So any patient who comes with a neck swelling, you have to take a very good history, do a good head and neck examination, the ENT examination, and then ultrasound, FNAC, radiological evaluations, and endoscopy and excision biopsy, and certain few other tests can be done for the various type of the conditions. One has to look for the specific signs in the neck swelling, because many of the neck swellings you can distinguish based on the age and location and duration of the tumor. Thyroglossal cyst, which moves with the protrusion of the tongue, the thyroid moves to deglutition, ranula, the transplantation is there, carotid body tumor and the neurofibroma of the vagus, they do not move vertically. Lymph node, they are usually multiple, and parotid, there is elevation of the ear lobule is there. So if you do the plain X-ray, though it is not very helpful, but sometimes you can find the cervical rib, the calcification in the carotids, there may be tracheal compression in the deviation, calcification in the thyroid can be seen, calcification in the vascular malformations, caries spine, laryngoscele, all can be seen on the plain X-ray. And the ultrasound is one of the very important investigation to locate the site of the neck swelling. It differentiates the cystic from the solid, and you have to definitely look for the vascular masses, because if the vascular mass is there, you are not going to put the needle in that. A CT neck is the workhorse for the neck swelling. It provides the three-dimensional relationship, and especially its relation to the bone is very important to be seen on the CT scan. Then MRI is mainly for the soft tissue, especially for the tongue swelling which is there, or salivary gland is there. MRI is very important. And if you're planning to do a thyroid imaging for a patient with the thyroid swelling, then in that case it's better to go for the MRI rather than going for the CT scan. And the radionuclide scan which is there is to differentiate between functioning and the non-functioning tissue. You can look for the thyroid and the parathyroid and various types of the scans which are there, which can be applied in a thyroid and parathyroid swellings. And then the positron emission tomography is good for staging of the head and neck malignancies. It can be used in cases of unknown primary malignant neck masses, and especially for the follow-up, it is very important that you want to find out that if there is metastasis there or not, go for the positron emission tomography. Then the CT MRI for the vascular cases, if there's an aneurysm disease is there, or great vessel surgery has to be carried out, or you are going for a embolization, then you do the angiography. And then the fine needle aspiration cytology, after you have ruled out that the patient does not have vascular tumor, you can carry out. It's a safe, rapid, and inexpensive method of finding the diagnosis. And then the triple endoscopy, you do the laryngoscopy, the esophagoscopy, and the bronchoscopy. And sometimes the nasopharyngoscopy is added to that. That's the pan endoscopy. And then few common ancillary tests can be carried out, like the thyroid hormones can be carried out, thyroglobulin can be done for a patient with carcinoma of the thyroid. So similar type of the few ancillary tests can be carried out in a patient with the neck swelling. Sometimes you have to go for the examination under anesthesia, especially for the deep palpation sites like the base of the tongue or the tonsil fossa or the posterior pharyngeal wall. You can combine it with the operative laryngoscopy, and you do a biopsy of that to find out the exact cause for that. And then there are so many lymph nodes which are there in the neck, up to 7 categories of the lymph nodes which are there. Depending upon the primary, you have to search for any metastasis in the various type of the lymph nodes, which can be reactive or it can be sometimes tubercular. Many times it's the tubercular, or secondaries, or it may be lymphoma, and it can be reactive hyperplasia many times. Sometimes even with the COVID you can get the lymph nodes in the neck, and then definitely the neoplastic swellings which are there. There are certain COVID-related neck problems are there, like the patient with a neck pain, neck stiffness, parotitis, lymphadenitis, and rashes may be there. So ideally, one should have what is called a one-stop neck clinic, though it is not in India, but like in UK, they have got a single hospital at a one center. They do all the type of the consultations and do a final diagnosis at the one center itself, and that will definitely is going to help the patient by an early treatment. It is not always necessary that you have to carry out the operation for all the neck swellings. Sclerotherapy has come out to be a very big way of treatment of the benign cystic lesion, whether it is a ranula or a thyroglossus cyst, which we always used to exercise, but you can treat them with the help of the sclerotherapy. You can use the OK432 ethanol, and we have been using the sodium tetrahydroxy sulfate for our patients with a very good result. So friends, finally the diagnosis of the neck swelling depends on the age, location and duration of the lump. In adults, if there is any swelling for more than 2 weeks duration, should be taken as malignant until unless proved otherwise. Thank you very much.